The liver is one of the body's most essential organs, performing crucial functions like filtering toxins, aiding digestion, and storing vital nutrients. However, chronic unhealthy habits can severely damage it over time. Excessive alcohol consumption is a leading cause of liver disease, as it overwhelms the liver's ability to break down toxins, leading to inflammation and scarring, known as cirrhosis. A poor diet high in processed fats and sugars can also contribute to fatty liver disease, where excess fat accumulates in liver cells, impairing function. Additionally, misuse of medications, especially over-the-counter pain relievers like acetaminophen, can cause drug-induced liver injury when taken in excess or without medical guidance. Recognizing early signs of liver damage is critical for timely intervention. Symptoms such as persistent fatigue, yellowing of the skin, jaundice, and dull abdominal pain in the upper right side should not be ignored. Swelling in the legs or abdomen and dark urine may also indicate liver dysfunction. Fortunately, many cases of liver damage can be prevented or slowed through lifestyle changes. Moderating alcohol consumption, eating a balanced diet rich in fruits, vegetables, and whole grains, and avoiding unnecessary medications are key steps. Regular exercise and maintaining a healthy weight further reduce strain on the liver, ensuring its long-term health and functionality. Many people engage in habits that contribute to liver damage without realizing it. Processed foods, often high in unhealthy fats, sugars, and additives, force the liver to work harder to detoxify the body. Over time, this can lead to fatty liver disease, a condition where excess fat builds up in liver cells, impairing function. Similarly, relying too heavily on over-the-counter pain relievers like acetaminophen can cause liver toxicity, especially when taken frequently or in high doses. The liver struggles to break down these medications, leading to inflammation or even acute liver failure in severe cases. A sedentary lifestyle also plays a role in liver health. Lack of physical activity contributes to obesity and metabolic syndrome, both of which increase the risk of non-alcoholic fatty liver disease and NAFLD. Regular exercise helps maintain a healthy weight and improves insulin sensitivity, reducing the strain on the liver. Experts recommend swapping processed snacks for whole foods, limiting painkiller use to only when necessary, and incorporating at least 30 minutes of moderate activity daily. Small, consistent changes can significantly lower the risk of liver damage and promote long-term well-being. To protect your liver health, a proactive and informed approach is essential. Regular medical check-ups are crucial, as they allow for early detection of potential issues before they become severe. Blood tests and imaging can reveal early signs of liver damage, enabling timely intervention. Additionally, staying hydrated supports the liver's detoxification processes by helping flush out toxins. Drinking adequate water daily is a simple yet powerful habit to maintain liver efficiency. Incorporating liver-friendly foods into your diet is another key strategy. Leafy greens like spinach and kale are rich in antioxidants, which combat oxidative stress, while nuts provide healthy fats and vitamin E, supporting liver cell repair. Reducing intake of processed foods and sugars also lessens the burden on the liver. Evidence-based lifestyle modifications, such as regular exercise, can improve metabolism and reduce fatty liver risk. In cases of advanced damage, medical interventions like medications or even transplants may be necessary. However, prevention through mindful habits remains the best defense. By adopting these practices, you can safeguard your liver's health and ensure its vital functions remain uninterrupted. Small, consistent changes today can prevent serious complications tomorrow.